Mhm. Ba, ba, ba. Okay, that's fine. I'm still in trouble, obviously. Ba, ba, ba. Puppy dog. Hi, y'all are going to get to meet Cody here shortly, and we will get started here in about 15 minutes, and hopefully the dog will settle down. Feel free to introduce yourself. Let us know where you're from. I know we did this last time. We had quite the diverse crowd. Number of folks came from across the pond in Europe and England, I think. And I know I've gotten a few questions from the Pacific, I think the Philippines in particular. So we'll get started here shortly. I'm going to get a little hydrated. I may wander back and forth, but come pull up a chair, send us your questions, just type them on in, or just tell us where you're from. And herbs, acupuncture, you name it, we'll think of something to say on it. And I've got quite the laundry list that one person sent me that was awesome, random thoughts that will take up 10 of these. Hopefully, I'm going to pull this up on my phone. I know last time I had a hard time seeing the comments. Oh no, I'm seeing the comments now. Hey, Natasha, North Carolina. Well, I'll be up there some point soon. We love it up there. I'm looking forward to the Medicines of the Earth conference coming back again. I don't think they're doing it this spring, but I believe they're going to start it up again in 2022. One of our favorite conferences there, right outside of Asheville in Black Mountain, and just fun to go up there hiking too. Wow, Arizona, we're getting people from everywhere. I love it. That's super cool. Yeah, I'm excited to see. We started this idea not too long ago, and just kind of got a wild hair and wasn't sure what kind of response we were going to get, and whether I could even do it with internet connections and all that fun. But really excited about the turnout we had last time, and I think we're going to have an even bigger crowd this time. And going to do my best to answer as many questions as we can in 2 hours without talking too crazy fast. And if any of you don't know it, I will certainly archive this on Facebook after it's done, so you can go back and listen to it. But we've been putting these all up on our YouTube page as well. Hey, Liska, how you doing? And if you don't know it, we do have YouTube page for the Tradition School of Herbal Studies. We're constantly adding to it, so we encourage you to subscribe to that. So as we get back on track and start posting a new video about some of our local plants and some uh, nice ideas in herbal medicine in general, both Western and Chinese, and Renee always sneaks some fascinating spiritual medicine stuff up there. And always, whenever we are able to start traveling again to South America, Central America, or the Caribbean, we always like to add as much stuff as we can on there. So if you're subscribed there, you'll be sure to catch it the second we put it up. And feel free to share any of those videos as you want. Hey, Ashley. And pardon me, I'm going to go top off my water so I don't get too parched whilst we're doing this. It's funny, I'm not sure why I wasn't able to see the comments last time, but I seem to be seeing them fine this time, so that's awesome. And for any of you who are just jumping on, we're going to get started officially right at 6 o'clock in about 10 minutes. Um, it's always challenging when, Arizona's a few hours away, so, different time zones. I'm outside my skill set to figure out who's in what time zones on all of this stuff. And I'm not sure, I'm sure I could post this, but you could find it on our Facebook page. Super excited. One of our students, husband works for a local TV station and just did an amazing article as well as something that showed up on all of the new, or on the local news channel here that just did a great job as a short walk through our new school and the gardens there. And allowed me to geek out for a few minutes. So we've gotten such a great response on that. It was Channel 13 Fox affiliate here in Tampa Bay area, but you can find it on our Facebook page for the school as well. Hey, Tiffany. No, no, not a problem. And bonus, if you check it out on YouTube, I'll be sure to post that before tomorrow. So for as long as we get extra credit for it there. We've got enough people subscribed to monetize it, but we need our viewing hours up. So if any of you get bored and want to just listen endlessly to the Bob and Renee dribble about cool herby things, feel free to listen to YouTube a lot. We're about halfway there right now. If you don't know it, you need, I think it's 1,000 subscribers, and we've met that mark, but you need 4,000 viewing hours within the last year, I think. And most of our videos are short, so I guess people are only looking at one or two at a time. And so got to get our hours up a little bit. So that'll happen soon enough. Awesome. Bonus. Thank you, Tiffany. I appreciate that. That's simple things. We got to put the word out on the street for that kind of stuff. So, one of I think Brittany's already graduated. She posted a ton of fascinating questions that are all over the board, and I'm going to pull those up on my phone so I won't remember them all off the top of my head. But we got the Wild West show of questions for tonight. Oops. Let's see if I can find it. I sent it to myself. There we go. So yeah, Britt definitely ran down the laundry list of stuff. So I won't say that there is any rhyme or reason. It's great questions though. So hopefully we'll get through. I'm sure I could get through all of those in 2 hours, and I'm sure some of you will have some good questions for us as we get into it. I find that on these kinds of things that what usually happens is as soon as I start saying some crazy thing that I'm bound to say, that it'll spark 10 more questions from everybody in the place. So I'm sure it'll be an exciting roller coaster ride for the next 2 hours. And I'm stalling a little bit too. Renee is lucky enough to be getting an acupuncture treatment right now. So, from one of our illustrious practitioners here, Eva is beating up on her for the last hour and a half, I think. Hey, Julie. Um, the so she might be a little out of it by the time she gets here. We shall see. I can smell the moxa from here, so we're stinking up the place. And oh, I hear sounds, and I'm going to say, Renee, be afraid, we're already live.
Hi, sweet. Hi, baby. Hi, baby. Do you have your list of questions?
I do. I emailed it to you.
Okay.
Come here. You want to come up here and say hi to everybody? I tried to get you set up.
Does he have a place to lay?
Yep.
Here you
right
go.
here between us.
You need to get on.
No, I'm on. We're already live.
I know, but I need to get on. You sign
Yep.
down.
Yeah, take your time.
How much time do we have?
You're fine.
Will you sign me on? If you don't know how often.
Yeah.
Hey, Renee.
And be afraid you're live, Eva.
Huh?
Be afraid you're live. Can't have us embarrassing ourselves too badly. She just went to the bathroom. What am I doing?
Oh, yes. It's not,
Yeah, we got a nice small crowd here. Hey, Paul. You can come say hi, Eva. You're allowed. You're allowed to say hi.
Yeah.
Or you can just hide. It's okay. So we already made Eva famous. She got interviewed doing cupping the other day, and we're gonna make her famous in about 2 weeks or so. I think
Not
she'll
sure
be
how wonderful that's
I'm sure it'll be awesome. Let's see. We can find. Oh, I don't know how to get her on here. That's okay. She's gonna have to figure it out from there. Renee, what up, man? Awesome that you're joining us. I'm sure I'm going to say something crazy. And I saw that you were going to do an article or a presentation at FASOMA on it looked like on neuropathy, I think you said. So hopefully some of these folks, whether they're in Florida or not, acupuncturists or herbalists can join us at FASOMA, the Florida State Oriental Medicine Association conference. I think we're going down south, so I think we're in like Fort Lauderdale or West Palm Beach.
I didn't know that.
Yeah, so this August, I think I'm teaching about I'm going to say stomach chi deficiency, but really
Thank you.
it's I'm going to sneak the idea of low hydrochloric acid in the stomach and our why we see a lot of cases that should respond well or not. So I'm looking forward to that. And
Yeah, it's okay. You can go.
yeah, neuropathy.
I'll
That's
go
a
behind you
great
then, too.
subject, Renee. It's one I'm super. Hopefully, always good information coming from you. So hopefully, I'll be able to sit in on your class on that. So it's I saw your comment on some thread. I don't know. I was reading randomly before I logged
How
on.
much time do we have, Bob?
About 2 minutes.
Okay.
So I saw that if you were going to be kind of looking at all those different causes of neuropathy, from chemotherapy to diabetes to I don't remember what else. But yeah, I it seems like we're permanently ingrained into FASOMA conferences that like a few other people sneak in, but we own the place. No, it's awesome. It's always a fun conference.
I might have to get a
And we're gonna
blanket.
get
I'm freezing.
yeah, grab grab a top sheet from one of the rooms. And so we'll get started here in about 2 minutes. That'll give folks a few minutes to get on
So
board.
anybody who's on already, just like last time, and if you weren't here, go ahead and start putting some stuff in the chat, and I'm going to moderate for Bob, write things down, and make sure that it gets covered. And we can talk about the goose syndrome we never talked
Well,
about.
yeah, we may not get to that because Britt actually, I
We have a
emailed
bunch
it
of
to you.
questions.
Britt just sent us this flow of consciousness that was amazing.
Okay.
I don't know. Are you on here yet, Britt? You
Okay.
better be after all those questions.
So
Fort Lauderdale. I knew it was around there somewhere.
Okay,
We've
so
been there before.
Bob, is it under Bob or
I
traditions?
don't. I think
Well,
it's.
if you want me to sign up,
Well,
you're gonna
try
have to
one and then try
figure
the
it
other.
out. Let's go here. See if DL is live right there. And then, oh my
All
volume
right,
all the way down.
we are officially at 6 o'clock, so hopefully more folks will wander in here. So if you haven't figured it out, I think I know just about everybody that's on board. I'm Bob Lindy. I am a registered herbalist and with the American Herbalist Guild and a acupuncture physician here in St. Petersburg, Florida. And we've got the practice acupuncture and herbal therapies as well as an herb school, the Tradition School of Herbal Studies. And I primarily teach the Chinese herbal medicine, but I always say I was a Western herbalist long before I was a Chinese herbalist. And Renee is sitting here.
I'm gonna say some stuff.
And,
Let me do
Renee is sitting next to me, and she is also a registered herbalist with the American Herbalist Guild and is a Western herbalist.
Hey
And
Bella.
she's moderating, but I know she's going to chime in on some of these awesome questions and comments and so forth.
I'm gonna
So,
get the rolly chair.
yeah, that's fine. And she'll probably, for some of you where it's just a one-word question, she'll type in some answers as well.
What I do want to say is we are on a delay. So this is what I want for everybody.
I forgot about that.
Is that I'm moderating and I won't let a single comment go by. I'm writing in a notebook next to me. So even if we've passed it, still please comment and ask the questions and I will flag Bob and go back to it that I'm recording every single thing that's there. And if I put a thumbs up or a comment next to it, that means I got it and I'm going to continue to write it because after we're done, we still can try to provide an answer if we don't make it in the time allotted.
And I'm going to say, this is the second time we did this. We did it a couple of weeks ago. And I'm really excited about the diversity of people who have shown up from.
Did you see Arizona?
Yep. Yeah.
Georgia?
No, I'm seeing the chat now. So I'm super excited about the diversity of people from folks like Renee, who's been practicing probably longer than I have, to people who have no idea, herbalists, acupuncturists, Western, Chinese, Ayurvedic. So I'm not sure how I'm going to fit it, but I'm going to find a way that we continue to do these going forward. So do watch. I'll find some other dates. In Fridays evenings are my only available moment free. And Fridays are nice because I'm not usually exhausted. It's usually an admin day for me. So we will be setting more of these up. Probably once a month, I'm going to try to do these. So I'll post these in the old ones and wherever we posted the last two. But I've been excited about everybody showing up, and I really appreciate it. And the excitement, whether it's our students, our graduates, or just friends, or folks we don't even know who they are. Sometimes I just I know your name. It makes it fun. And Natasha, I'll actually, as Renee's kind of going through the word list, I'm going to talk about tinnitus, depending on which side of the pond, as far as I'm concerned. It's funny, I've seen the argument back and forth. But the ringing in the ears is really a common complaint. And I'm going to say it is one of the most challenging issues that I've had to deal with. Um, I'm going to say that most issues people come in with, I tell them I have about an 80% success rate. Some things more, some things less. Tinnitus, it's a crapshoot. I'm going to say about a 50% success rate. And I find that if I can't change it even a little bit in the first 3 or 4 treatments, I'm probably not going to have success. Doesn't mean somebody else won't have more success than me. Um, whether we look at it from a Chinese or Western standpoint, I think it's important that we don't just treat tinnitus, that we don't just treat this ringing in the ears, that we make sure that we're looking at it from, and the dog may go crazy because Trisha's coming back in. Oh, actually, I know that's not who it is. Um, that that we do good differentiation, and we can do that. So let's look at kind of medical causes, then we'll look at Chinese causes. The most common one is rock and roll, and we're seeing an increase in sound causing nerve damage in the ears. We're seeing an increase of that. It used to be you'd see construction workers, military, somebody was shooting rifles, hunters, things like that. They weren't using good ear protection. It literally, our nerves would become damaged. With the onset of cell phones and iPads and things like that, and we're putting those earbuds in and cranking up the music, we're seeing folks in their 20s and 30s are having it. I've found that's probably the most difficult type of case to treat. And I'm going to say, from a Chinese perspective, that's oftentimes a blood stagnation. We also see hypertension, high blood pressure can have a significant impact. That concept within Chinese medicine of liver yang rising or heart fire. And you mentioned stomach, that there may be a stomach fire involvement with that as well. Chronic ear infections where there's a phlegm and heat component to it. Again, that can be viral, bacterial, or fungal. We oftentimes see that there is chronic overgrowth of yeast in the eustachian tube, or that there's been damage from the multiple antibiotic use, even as a kid sometimes. There's also drug-induced ones. And so anything from an aspirin to cholesterol meds to hypertensive meds and some psych meds can all cause tinnitus issues. So looking at that differentiation, and so you're seeing, it's super interesting. So it's funny. Certainly coming up with that, and it sounds like there is a distinct food issue or digestive issue, like you said, and
Those are two different things.
yeah, no, and I'm sure I only got a small number of the possible reasons for tinnitus. Stress and anxiety can cause it as well. So from an energetic standpoint, it can be both excess and deficiency. But if there's nausea, vomiting, dry heaves, things like that, we would look at that probably either as most likely an excess in the stomach, either a stomach fire or food stagnation, both of which could have an impact on that. From a Western standpoint, I would say look at anything from low to high stomach acid. Sorry, I choked on my tea. Low or high stomach acid, and in particular, and certainly medications if there's anything in there. In particular, I would say low stomach acid, if you don't know it, manifests oftentimes like acid reflux and high stomach acid. Um, um, and with the low stomach acid, we start to see things like SIBO, the small intestinal bowel overgrowth or bacterial overgrowth, depending on how you translate that. And a lot of food sensitivities, and all of that can then start to, over time, manifest in that eustachian tube and in the ears. We may see excessive moisture or wax in the ears, having a role in all of that. And and Aliska, great one, like especially for some of that stress related. And so if you've ever had an anxiety attack, like getting in front of a bunch of folks and talking, trying to deal with random questions, Okay. Um, that we'll see, anxiety literally, that the vision narrows, the ringing in the ears. It's actually a stress response that can happen, that we'll see um, to the extreme, a vasovagal response where the sympathetic parasympathetic nervous system literally just drops the blood pressure and cause you to pass out. And a lot of times we'll hear some, that low ringing in the ears, and that can actually um, be then that adrenal burnout, HPA axis, when we start to talk about some of those issues. And Natasha, yeah, the overuse of antibiotics. There's actually specific types of antibiotics that are linked with tinnitus, and so that's not uncommon at all. So very, very common. So looking at what your cause is, and it's funny, like we're so busy attacking the ears that sometimes we forget that some of this other imbalances. And so whether you're looking at it from a functional medicine standpoint or an energetic Western or Chinese, that good differentiation as to what's the individual, not the symptom. And so if there's what makes it better or worse, what time of day or night is it worse, is there certain foods that are triggers? I'm going to say if they had overuse of antibiotics over the years, every time they have a sugar or carbohydrate, that's probably increasing their inflammation, or that candida or fungal yeast overgrowth in the eustachian tube, it's increasing it. Look at that, I didn't even know opiates would cause it, but I could see that as well.
Anything that would cause a deficiency.
Yeah, the opiates, because we'd see the constipation that's caused by any of your opiates, that really backs it up
And
some.
let me add to that,
Yeah.
anytime that we have anything that's affecting the nervous system receptors that are considered to be excitatory, if you have something that's always triggering an excitatory response and you don't have the fuel to give to that excitatory response, it's kind of like running a marathon all of the time, that you would become deficient. So you might be able to have that medication for several months and have no problems, and then have an onset 6 months into it because you finally burnt your stores out. So we have to make sure that when we're doing, even when we're doing herbals that would consider to be excitatory, that we're also feeding, supporting, and nourishing at the same time.
So, and I will say, acupuncture can be very helpful, both in a deficiency and an excess state. And it's funny, there's a number of both local points that are around the ear that can be helpful. Um, there's also on the Sanjiao meridian, that there's some acupressure points that are specific for tinnitus here. Sorry, you can see the palmar sides, Sanjiao 5-6 in that area. Um, and LI4 here, large intestine 4, can all be helpful acupuncture points. I actually will frequently, if I'm having a hard time coming up with why you got the tinnitus, I'll start going around and palpating some of those acupuncture points to see if there's even a slight change or reduction in the tinnitus at a particular time. Um, and that helps bring me to an understanding. Uh, it is not uncommon. We frequently see tinnitus in the elderly, where there's a deficiency or a mixed state. Um, that Lue Dihuangwan, a variation of that contains magnetite. Let's see if I can
The
spell it right.
Chinese name for it.
Yes, I think is the magnetite. And Renee, feel free to correct me on that. That doesn't look right, the spelling. And honestly, I can't think of the name of the formula off the top of my head. It starts with a
It
CI.
just boils down to an additive that is a blood builder, a
Yeah,
nourisher,
so
and that would be the
it's
reason.
yin nourishing, and the magnetite is specific for the tinnitus and helps partly reducing, well, as the foundational formula, the way the six flavor Romania formula. Or any of you like studied with Michael Tierra or anything like that, that might get you pointed in the direction. Thank you, Renee. That's one I got to look up because I don't use it very often. Of course, if you're using literally stones, the magnetite, and something that's a very, I won't say strong, but effective yin nourishing, You always have to make sure that you're not damaging the digestion, causing an increase in phlegm or loose stools with that. So don't just run out and grab that formula. Oh, yep, there you go.
Mhm.
I had the sounds right in my head, but I didn't have the spelling right.
Mhm.
You had to check it too, I know. So yeah, great question. And I'll tell you what, it's not you. I've created some topicals for putting in the ear that I've had mixed success with. The formulas, definitely one of the hardest, and sometimes people have had it their whole life. So don't feel like you failed. It is truly one of the more challenging things to address.
I have a question for you. I know that you
Yeah.
just spoke a lot on that, but I have a question for you about that from a practitioner standpoint. For everybody on here who's not a Chinese herbalist and is any other kind of practitioner, I'm gonna give Bob a broad question about what he just said to see if he can articulate a pattern differentiation for us. So that can you think in your head that
No, I'm not
maybe
screen.
somebody who has had that problem for a lifetime came in a little Jing deficient, therefore being a little
Yeah,
deficient?
actually, yeah.
So that maybe, with the exception of having a misshapen eustachian canal,
Yeah,
you
if
know what I
you
mean?
have, if somebody
Does it come
came
down to
in,
deficiency, is what I'm saying.
not always.
Yeah.
So it's excess or deficient. And whether we're talking Western or Chinese doesn't matter. A tense condition, what we would call like a qi stagnation, can cause it. A heat condition, both deficient and excess, and phlegm conditions, if we're looking at that energetic pattern perspective. But Jing would fall into it too. If we had somebody with developmental delays, they came in with genetic defects or structural defects, all of those are potential issues. If we're looking at somebody with Down syndrome, depending on the severity, they may or may not even be able to articulate it because it may have been there literally since their birth.
Okay.
Yeah.
All right. So you have to tell
I was
me,
going to say,
do you
throw
want
in
me
a
to?
Brit. I haven't seen any new ones. Throw me a new
Okay.
question.
Okay. So I'm going to let you
Oh, and
choose.
actually, I'm going to say something else to look at if they're not on other medications. Certainly, you mentioned the long-term use of antibiotics for this particular client. Look at probiotics and varying your probiotics, improving the gut health. Explore SIBO because it is possible to get the tinnitus with that. But also topical St. John's wort oil in the ear because it can be a nerve damage, and that St. John's wort oil on the ear is so specific for nerve stuff and inflammatory nerve issues.
And you see what she said, that she started
Mm.
in they've done adjustments. So
Nice. Yeah, and actually I didn't even think about that. Doing the cranial sacral kinds of things all are great.
um Paul added in gut purging, and
I'm not
I
sure.
don't know in what reference that would
Yeah,
be.
Paul, explore a little or explain a little bit more gut purging because my running joke would be that sounds like colon blow, which I don't usually I don't usually go there.
Uh in
Ah, okay. Um, that that may or may not be an appropriate use. It is one way to start to readjust for things like SIBO. Um, looking at it, and pardon the pun, killy stuff. Garlic being one, and garlic being very hot in its nature and can be very irritating. And actually, one of my students right now is got a I'm going to say severe allergy bordering on anaphylactic to anything in that Allison family of plants or genus of plants. So can't use that on everyone. So I would probably start a little bit more gentle before I did that. Uh,
I so can
but yes, even though we don't classically see a connection to the ears and the gut in Chinese medicine in particular, we connect the ears with the kidneys. But, and I think maybe what you're thinking is not wrong. When we look at the eustachian tube and its connection to the nose and the throat, ultimately, that we could say there's a lung, large intestine. We would see the some of the issues with that, with either loose stools or phlegm in the stools or even constipation, especially from that overuse of antibiotics or potentially um, uh, uh, poor choices in diet. And Renee, thank you for uh, Renee, who just posted on there. I would say I can say is an expert in the tongue acupuncture. If I remember right, one of his first graduates, I seem to remember a picture or something like that. And I am a huge fan of both the tongue and the Dr. Tan methods. Although I've not formally trained, I certainly steal a few things.
So what you're saying is everybody can
Go see Renee.
happily see, like, listen to what Renee Ing is saying on
Yes,
the
I
chat.
usually agree with him on stuff.
Absolutely. And it wouldn't matter if we didn't, it would be of value to look at it for sure. So let me go. Can I go to another question
Yeah,
that you
please.
missed that went by?
Oh, yes, please.
I think I know what the answer to this is going to be, and so we're going to go ahead and read it out. So basically it is from Owen.
Oh, I
And
missed
it
that.
was
You're right. How did I miss that?
what would be common reasons for a plant-based diet that had been plant-based for years to all of a sudden be having belching right after a
Oh,
meal,
great.
then lingering into hours, and in some cases upon waking up the next morning.
Oh, brilliant.
Yeah.
Okay. I hate to say it, that's super
Common,
common.
yeah.
We see that a lot, and I'm going to try not to create a controversy here. A plant-based diet, I actually think is good, except plant-based diet is actually code for vegan usually. And I think that the base of our food pyramid should be plant-based. But I find that people are healthier when they intersperse a variety of proteins throughout their day and within their diet to include meat sources. For folks, and I always say for health reasons, that the research pans out that Mediterranean-based diet, and there's variations in the amount of carbohydrates. It's like, don't stress out about your food. Eat healthy. Um, but for folks and I always argue that from an ethical standpoint, a vegan or plant-based diet in that form is correct. The challenge is to get certain nutrients that are challenging to get. I won't say it's impossible, but it is very challenging. And so the most prominent of those is B12. And actually, that goes back to one of Britt's questions that she
We'll
had,
get to it.
that she was asking about B12 in particular. And so B12 over time, as we start to look at the methylation and the citric acid cycle and all that kind of cool stuff, that B12 is one of the necessary building blocks for our stomach acid, for the hydrochloric acid in the stomach. And so most of us have an okay store of B12 in our body, even though it's a water soluble, we do retain some of it. Um, and there are vegans who eat a very healthy diet, work very hard at ensuring that they're getting diversity of plants and fats and proteins and so forth, but they have to work really hard at it. And what I always say, it's like, no, you're doing a good job if you're doing it for ethical reasons, and they'll supplement with your B vitamins, in particular B12. It's been our experience that at about 3 to 5 years, depending on how healthy of a diet you had prior to becoming vegan, your stomach acid shuts down from a lack of B12. And
And the majority of it's usually cold too. Like people are
yeah,
eating a
if
lot of
somebody's eating a raw food
carrots and
vegan and
yeah.
so forth, then it goes a little bit faster oftentimes. And so depending on the amount of raw food that you're eating, that may come sooner because you need more stomach acid. At about between 5 and 10 years, we start to see mineral deficiency starting to happen because it's really dropped too low. So I encourage people, when I see that bloating, belching, acid reflux like symptoms on an empty stomach, and sometimes even on a full stomach, that I have them try for a week taking hydrochloric acid, HCl. If that has either positive benefits or no effect, they got low stomach acid. It's literally that's
That's how we know.
everybody just heard my Fasoma lecture and wrapped up in
No,
2 minutes.
what is a cheap way to test without having
Yeah.
to go to a doctor?
And if it causes acid reflux, that's not the problem then. And so you just stop taking it. Luckily, HCl is very inexpensive. But it also means that if you have no stomach acid, and here's the conundrum. So I don't want to say how many people have come to us with very chronic digestive issues, chronic fatigue, fibromyalgia, all of this. And It usually happens 5 to 10 years after they've started eating a vegan diet, oftentimes a raw food vegan diet, where they haven't done their homework. They haven't looked. There's the Snickers bars and are vegan. That doesn't mean they're good for you. So they're eating a very limited, not diverse, and they're not ensuring they get enough fats, enough B12, and so forth, and eating that plethora of amazing fruits and vegetables and grains and whole foods and so forth. They're eating this very limited diet that usually tends to be a little bit too sweet. So once we lose our stomach acid, we need the stomach acid to absorb our minerals. We need our stomach acid and using that intrinsic factor that's a part of the digestive system to absorb the B12 to get that from our foods. Um, and if your gut flora is out of whack from either overuse of antibiotics, taking acid reflux meds, or any number of other possible
Cold
reasons.
diet.
Yeah, any number of reasons why our gut flora, our gut biome is out of whack. We may not, even if we're taking a B12 supplement or B complex supplement, you may not be able to even absorb and utilize those nutrients. Not even, and I'll throw in there just to confuse everybody. If you have a genetic mutation of the MTHFR gene, also known as, and pardon me for the motherfucker gene, which is appropriate. If you have that, you're also going to be challenged to methylate that B12. So there's so many roadblocks that can potentially be an issue. Many of them, well, there's two things that can be helpful with that. If it is a potential low stomach acid, starting to utilize the hydrochloric acid about 15 minutes prior to every meal. So at least 3 times a day. Or depends on how often people are eating. But I would say also making sure that you're taking your B vitamins, the B12 in particular, with that. Otherwise, you may not be able to absorb it. I will add to that, there's more than two forms, but there's two primary forms of B12, the cyanocobalamin and the methylcobalamin. The cyana is the synthetic form and the least expensive and most common, both for oral as well as injectable. And the methyl is the natural form. There's huge debate in the industry. I generally encourage the methyl or the hydroxyl cobalamin, which is a further down the chain of broken down, and there's arguments why to use one or the other. I honestly don't care as long as I encourage people to either do the methyl or the hydroxyl. The methyl is easier to find and a little bit cheaper than the hydroxyl. And that can really help to turn that around. It's night and day. If that's the issue, you see a dramatic shift. Um, this can also be one of the most common nutritional deficiencies we see from prescription medications is B12. Leading that parade, I'll list two, but that's the list is much longer than that. Any of your acid reducing medications, whether that's a Tums or a Protonics, any of your H2 reducing things will eliminate your ability to digest and absorb minerals and B12. But also, birth control is a really common prescription medication, and it reduces B12 along with many other issues. Um, so it's one of those things that is a simple thing to test through blood. If you're a Chinese or Western or Ayurvedic practitioner who uses tongue evaluation, we can look for that thin, pale tongue. And I would say within Chinese medicine, actually, a puffy tongue with teeth marks or thick tongue coating in the digestive spleen stomach area, all of those can be indicative of a B12 deficiency. And just kind of different stages of severity can all lead us down that path. That spleen qi, stomach qi deficiency, I would say, has a very close relationship to B12 deficiency.
So it's your choice on whether or not you would like
Sorry, I
to.
rambled a bit there, but hopefully that
Right.
kind of helps.
And you guys, I'll do my best to reel him back in. It's your choice whether you would like to continue on this subject and go to a secondary side of Britt's question about vitamin B, or whether you'd like to choose something else. See what I'm saying?
I kind of answered it. I'll actually add another layer of the B12 just so I can say, Brett, I did answer some of your questions. Um, the two most common, and I think I kind of said the methyl is the natural form, the hydroxyl cobalamin is a further breakdown down the chain of its utilization. So cobalamin is fancy talk for B12, but this cyanocobalamin, it's funny. When I first saw it, I was like, "Oh, it must be blue in its color somewhere along the line."
Because
It's
sienna
it's actually
is yellow.
no, it's actually a cyanide molecule.
Nice.
And and it's funny. There's always talk about when we look at those cyanatic compounds in certain stone fruits and elder and things like that, and like, oh, we're taking cyanide. Um, the reality is there are different types of cyanotic compounds, most of which are not dangerous to us until they get altered into a particular form that will kill you. So the cyanocobalamin is more stable, it's more room temperature stable, and it's cheaper, but it is synthetic. There is huge debate and huge diversity in the research as to what's more utilizable. And so it's around 40 to 50% absorption of any of the forms of B12. Um, but what we find in there a slight nod to this, but it's arguable. Um, that the amount of urinary excretion is higher in the cyanocobalamin, the synthetic form. So our ability to utilize B12 is better with the more natural forms, the methylcobalamin.
So I want to interrupt you because one of the things that she was saying is not even about use because I have a lot to actually say about this if you don't want to say it. A secondary part of that question was, is there any issues that come from long-term
Oh, yeah,
use?
right.
And I know that I have massively seen that experience of
Yeah.
it causing the
Yeah.
symptoms. Yeah, so
So
let's
so
speak on that a
it's
little bit.
funny when we look at B12 deficiency, the most common thing we talk about
Or
is
any B
it,
long-term use
yeah,
or too
but
much.
B12 in particular, we look at fatigue. Is that leading the parade? We can see deficiency in red blood cells. We see anemia, and but it can get to the extreme where muscle wasting, neuropathy, depression, and there's a host of like there's been extreme cases of extreme B12 deficiency where people were thought to have MS and all these severe autoimmune disorders. It does have a role in our immune system, our mental clarity, our mental health, and the range is pretty high for the what is an acceptable range. I think it's like it's close to 300 is the low end, all the way up to just under 1,000. Uh, and I forget how they're actually micrograms or whatever per deciliter or some such. Um, but the reality is, I find that anybody who's below, especially for a meat eater, if you're below 800, there's an issue. I actually push people to the higher end. And I don't worry about it as long as they're under 2,000 on their blood work. But in the same sense, even though we say all of the B vitamins and B12 included are water soluble, i.e., you pee them out, that they're not stored in large amounts in the body. And I have seen cases of the overuse of it when we start to put the massive dosages in long terms that it starts to create those same problems it solved. So I find that people are doing a great job. Your fatigue, your chronic fatigue syndrome, your depression, all of these things were alleviated by improving your digestion, working on methylation, and daily supplementation of your B12. And you're like, more is better because here in America we supersize everything. And sorry for the political grandstanding there. And so we start doubling and tripling our dosage. And then all of a sudden we see the return of those issues. To me, that's a hint that A, we should get a blood value to see whether we have an excessive or toxic amount of that, and then literally stop the B12 and see if the issues resolve. And so it's you got to work at it, but it is possible to do too much. I've seen a very, very small number of cases of B6 and B12. I would say to the point of toxicity, but once they stop taking it, within a few weeks, they return to a normal state.
Okay, so you have to decide. Do we want to take a one off here or one off Brit's list?
Whatever.
There's like some shorties that we can like go to and you
Sure.
can have an opinion about right now, which is one of the things that is on this list is why do we not tincture powders? And what I want to say to Brit is why do you think we don't? Yeah, like I don't, we powder up things all the time to tincture. So like, why did you not think I mean, I've never taught you not to tincture powders.
Yeah.
And you went to my class.
So there's
So,
the word powders, depending on who you're talking to, may have a different connotation. So from a Western herbal standpoint, we can take a root or a leaf or a flower or whatever, and we can grind it into a powder.
I
You
know, but I don't
100,
even tincture.
yeah,
Yeah.
but 100% you can tincture that. The other type of powdered is the powdered concentrate that we use in Chinese herbal medicine. And I would say, no, you can totally do that. It is not my first choice, and for no particular reason, honestly.
I was gonna say
I don't
why?
know.
Because it's like it's like you'd get a bigger bang
If
for
I
your buck.
if I'm tincturing, I would say I would rather use the whole plant.
I agree with
Any
that.
kind of processing to include the powders, you lose something. Not a lot, but you lose something.
Mhm.
But there's times when I'll have a great pre-tinctured formulation, and I'll go, I just need to add some of this, and I'll dab a little bit in there,
100%.
and works like a champ. And you just got to make sure you shake it and that it's dissolved properly. If you're working with a high proof alcohol like a 195 or something, it's less of an issue. But I would say a lot of times with that high proof, that 190, 195, we need to dilute it down anyway just to make it palatable. So you could take that powder, get a little slurry in hot water, that powder concentrate, to put it into solution and
Proof
use
it
that
down.
to dilute it to
Mhm.
proof down your tincture. And I'll say also, Renee, if you're still on there,
I have something else to
did
say
a
about
really neat
this.
thing. Like he was teaching a class on trauma formulas. Decock,
Plasters
yeah, he
and
was,
yeah.
and he taught a really neat class in plasters. And that was one of the things he did. He was like, normally we might use the whole herb and grind them up and using resins and things like that. He was like, yeah, but if I remember right, we just grabbed some powdered concentrate off the shelf and it's like, this works just as well, and actually made some phenomenal plasters with that. So it was a really he demonstrated that all of the things that we do normally with herbs and things like resins are really hard to work with sometimes, whether we're making a plaster or a tincture. The ability to use them once they've already been processed into those 5-to-1 or higher concentrates sometimes simplifies the process a little
And I have
bit.
one more thing to say about that. And that is in the class that the question of the student that came from this, who is a practitioner,
Yeah.
in that class, I taught you how to make a powdered tincture ahead of
Mm.
time. So for what Bob was saying about the resins, we could have tinctured in a high proof of resin, made it more bioaccessible, turned it back into a powder, and then added that resin to powder back in anytime you want. And that actually feeds into your next question, which is can you put pine resin, can it be burned, and can you put it right topically on a wound? And absolutely, especially as a powdered tincture, I would put it on a wound and it's easier to use. But my point is we've always powdered, like we've always
Yeah.
used all kinds of
And
versions of powders.
and pine resin's such a fascinating thing. Here in Florida, and
We're
in
in Pinellas,
Yeah,
Florida.
Pinellas, Florida.
She says,
It's
can it be burned? Can it be
such a
on a wound?
common thing that is the blood of the tree, and so any kind of a scar or injury to that tree, we see the tree sap come out, and that can actually be taken out fresh and used to close a wound. It's antimicrobial,
Yeah,
and it will stop
100%. I would use it topically.
bleeding.
Yes.
You can help to actually pull the edges of a wound together. And I would say, no, there's 1,000 other things you could use as well, but pine sap is readily available. It can be used, so it can be used topically for rashes. It can be used internally for lung issues, lung
One of
congestion,
the questions was
arthritis.
any pine needle for pine needle tea. Yes.
So, in ensuring, yeah, so any pine will do, but there are many conifers and evergreens that are not
Not
pines,
pines.
and some of the
Are
evergreens
toxic.
are toxic.
Yeah.
Yes, so we do need to be careful and make sure that we're doing good botany with any of our pines. But if it is a pine, a true pine, yeah, I don't care. And everywhere except maybe Antarctica. Okay, Antarctica I know doesn't have pines, but pretty much everywhere else, even as we go into Canada, Central South America, Asia, Europe, all have some sort of a pine as far as I know, and those can be utilized to great success.
I'm sorry, I'm laughing at Elizabeth's comment to our powdered things.
Yeah, yeah.
Okay.
Renee is. If you don't know, many of you may know one or the other of us, but Renee kind of rocks at the whole medicine making, and
Could you
really has some amazing
specify that
tricks.
there's two of us too?
Oh yes, sorry.
Mhm.
This Renee, who's sitting next to me, Renee Prince,
But Renee
is
King also
Renee
is.
Yang is a phenomenal medicine maker too, but very different. And Renee's got some crazy, I would say, very advanced techniques that are below people's minds.
So we can either go on with another medicine making thing that popped up, or I can go to a VDR mutation for vitamin D, TCM formula for lymphatic, or a fern eczema
And I'm
vitiligo.
Yeah, let me actually. Paul had a
That's what I'll
good
say. You want to do
question.
Paul?
So, is there a way to macerate without alcohol, or
Mini
add a
ways.
couple of tablespoons of overproof before boiling down? And I would say you have to be really careful with alcohol and heat, because once we add heat to an alcohol, we're putting a pure alcohol into a gaseous state, which is really explosive.
And I can I comment on this
Oh, please do,
because
because you know more about this than I.
because I've had to do this.
Yeah.
And so in several reasons, because we're supposed to be using really good energetics and we're supposed to be using hot, cold, wet, dry with our clients as well as the plant. And so in several cases, I've had people who have had really strong heart medicines or something that was up in the chest area. And I would have something like a maceration with a vinegar causing heartburn, or a maceration with an alcohol causing a heat that was rising, and they were affected in their heart medicine. So what we had decided to do, and it seems to have worked, is that we would wet it just enough to soak it. There would be no liquid left at all. We would let it break that cellulose open, extract those minerals or whatever you were trying to extract, make sure there was none left in it other than what the wet plant was, dry it completely, and then use that tinctured in another form or in a decoction with a lid, and had it be more bioaccessible. We've had it work. And so, yes, if you macerated it just at the point of wetness for a few days in a closed container, or in my case, it would be 6 weeks, but we can't wait 6 weeks, and then made it the way that you needed, as long as it was closed, like a decoction, you should have your lid on. And so as long as we did that, we seem to be completely fine, and it seems to enact its bioaccessibility.
And we can also use things like glycerin and so forth as a way to extract things. So,
I said vinegar as well,
vinegar,
but
yeah,
there was a reason not to use a vinegar at some point, but I
yeah.
needed the minerals busted
And,
out, so I had to
and I
figure it out.
will say, if you go to the traditionsherbschool.com, we have a link to a book there, the Medicine Maker's Handbook, that is, whether you're a beginning medicine maker or an advanced medicine maker, I consider that the Bible. There's other books out there, but there's none are more greater depth than that of James Green.
James Green.
Yeah,
Mhm.
James
The
Green.
other thing I want to say about that is when we teach medicine making for advanced classes, if you are a practitioner, we do allow you to come. So we will have a series where we'll have beginning, we'll have intermediate, we'll have advanced, and Bob and I will take different places at different times to teach. And so if you ever see that come up, that's if we know you're a practitioner, we allow you to sit in for those classes for sure, to take them with our students.
And there was something about skin stuff. What was
Yes.
that? I
So
saw that a
the
while back.
vitiligo one was, it's Jerry from your class
Mm.
and from my class, and it was asking about polypodium, and
Yeah, I
I
don't know
have
how to
to
say
say
anything.
it's the leukotomas, I think leukotomas, and it's just fern. And it was the use of that as a free radical agent in what he had listed as eczema and psoriasis and atypical dermatitis. It really is used pretty successfully in vitiligo. What I want you to speak on with that is those are all different mechanisms. One of them is a reaction to an item. Two of them are autoimmunes. And so an atypical means the
Yeah,
doctor doesn't know and is
yeah,
blowing
yeah.
you off.
No, I know.
And so
Yep.
one free radical expression across the
Mm.
board, anything can do that. That's going to
Renee,
regenerate
can you put
cells.
a link from the? Oh, sorry for the music going by. Link from the tradition school to somebody just asked for that.
Yes.
Oh, yeah, there you go, Julie. Thanks.
Thank you,
Um,
Julie.
and so I'm going to go from generic and get a little bit more specific. Um, Skin stuff, both acute
Thank
and
you,
chronic.
Liz.
And there are, skin stuff can be anything from I just poured, well, one of Renee's kids just burned himself really bad. That's skin stuff.
Mhm.
And an acute issue like that versus chronic or autoimmune disorders like vitiligo, some of our eczema, psoriasis kinds of issues. So it's funny. I'll start from a Western perspective. We always, for chronic skin stuff, and pardon me for being so vague, but it doesn't matter. For chronic skin stuff, we start in the gut and ensuring that the gut is healthy, reducing mast cells into a normal state with things like burdock, nubangzi in Chinese. We use the burdock seed in a similar kind of way, but I prefer the burdock root. Dandelion may have a role, but burdock is my go-to. There are other things like nettles and so forth that can be helpful. Alfalfa, chickweed, cleavers all have a role in that. And there is a wider list of that, but those are usually our starting point for chronic skin conditions. From a Chinese perspective, we actually, it's funny, and the opinions vary. I was taught, and that's the way I oftentimes teach it, that all of our skin disorders, in in some form or fashion, have a blood deficiency in its root. That we cannot neglect that, and it doesn't mean somebody's anemic. The idea is in order to keep our skin healthy, and I should say primarily in the case of chronic conditions, but somewhat in acute, that there are many reasons why in a particular area the blood may not be moistening, nourishing, and keeping our skin healthy. And so it can be anything from a trauma that is not allowing for a good flow of blood to a very small area to a more systemic kind of issue. And if we think about what is the production of blood within Chinese medicine, we go back to the digestion, the spleen. And so our ability to have a healthy digestion, whether we look at it from Western or Chinese, I think is a very similar kind of approach. Um,
Did you read that?
yes.
Yes,
And,
I
and
agree with
Natalie,
that.
yeah.
I was getting ready to answer it.
Burdock is like my starting point for mast cell stabilization. Not to say there aren't a gazillion other things. There you can even use things like calendula can have a role in that.
I know, but we always add
Astragalus,
burdock in
yeah,
because of the dual
yeah,
component of the internal external for
yeah.
sure.
So I would say I would start with that, but also don't just skin burdock. There are many reasons why our skin can be messed up long term, and I would argue that starting at ensuring that we have a healthy gastrointestinal system, and however one chooses to evaluate that, because we can look at the gut biome with the good probiotics. We can look at that from a Candida SIBO kind of perspective. We can look at that. One of the largest collections of lymph nodes is all along the small and large intestine. So we can ensure that we have good lymphatic action from the Chinese, looking at spleen,
So
qi
I'm walking
deficiency, and
away, so I need to
phlegm.
give you two prompts.
Yep,
The VDR mutation, which is when you
yep.
can't absorb the
That's
vitamin
enough.
D,
Yeah,
that's one.
yeah.
Or you can deal with
I'll start with that.
TCM formulas for lymphatic
Yeah.
drainage.
So start there. But one of my favorite ways, and I also say I know there was a mention of vitiligo in there as well. There are, and I for the life of me can't think of the name. It says vitiligo formula on the front. But there is a Chinese formula specific for vitiligo. I've had mixed success with it. I've also used a variety of internal and topical herbs, uh, both for symptom specific. It's funny. I recently had a person. He was, I think, from Mexico, if I remember correctly, and thought of himself as very healthy. He generally was, but his biggest issue was an overconsumption of wheat and corn, and specifically for his vitiligo, which is a poorly understood autoimmune disorder. And I utilized both topical to increase the blood flow. Score food.
I thought you
To
did good.
increase the blood flow to the local area, but also working on those inflammatory factors. And one of the challenges, as herbalists, as acupuncturists, we sit there and go, don't eat gluten, don't eat corn, and then we assume that everybody knows what that means.
Yeah, I
And
find the
so,
carbohydrate thing is really not explained.
so it for this guy, where his traditional food was tortillas that his mom would make for him, it was like, it's a tortilla. It's not corn. It's not wheat. It's a tortilla. And so, the idea that there is gluten in wheat, that's in soy sauce, that
Wasn't a consideration.
it's in every single marinade, in half of our dry spices, all have these things mixed in there. And when we start to look at, if you want to really go down the crazy train, I think it's something like 90%. you know,
And we see
I'm going to spare
reactions.
us that diatribe about that.
Mhm.
So, nourishing the body, ensuring that there is a healthy digestive system, making sure the lymphatics are working. And then topically, if it is a fungal kind of issue, so an external kind of thing, looking at aromatics topically. I love topicals for chronic skin issues. Um, and if it just needs nourishment or an increased blood flow to an area, looking at both Western and Chinese formulas can be so effective. So, one that nobody ever thinks about, it's one of my go-tos for needing to increase blood flow to the skin, is rosemary.
Mhm. The
Rosemary, the
wonderful
plant
rubefacient.
rosemary, the
Mhm.
rubefacient properties.
Mhm.
It's literally, we can use it for a face nourishing, especially as we get aging, dry skin, and we want to nourish and get that glow. Literally, a face rinse made with rosemary is great. I use it for, it's a natural hair colorant for dark hair, as well as helps to ensure for healthy hair by making sure that living thing, the root of the hair, is nourished with blood. Um,
I have so many.
I know I'm
Yeah.
not going to spend 6 hours
Okay.
talking. Although I do want to say one other thing, because I've had a couple of clients or patients over the years with dyshydrotic eczema, which is a very unique form of eczema that primarily only is on the palms of the hand and the bottom of the feet. It's horribly painful. And I found it has a very direct relationship with food. Um, Again, another autoimmune disorder that nobody freaking understands. And by total chance, I found that high dose of L-lysine is very effective for it. And so, for any of you who have patients, loved ones, or yourself dealing with this very unique form of eczema, do some research on that. And I hate to say it, I figured it out by total accident because I was treating somebody for something else who happened to have dyshydrotic eczema. They had a very positive response because of L-lysine's role in collagen production, because one of the other side effects of the long-term dyshydrotic eczema is a decline to the point of horribly painful decline of the collagen in the palms and the bottom of the feet. So
Okay. So, do you want me to?
VDR, VDR.
I was going to say, do you want? We can do VDR. I can take two of these questions easily. Will you do what you need
And
to do over there?
I'll talk crazy because VDR is fair. I don't think it's very common, but it is a genetic trait, and I may be wrong on this, but if my memory serves me right, it's genetic trait that makes it challenging to process
Vitamin D.
the
Yeah.
sunlight into vitamin
Mhm.
D. And so, despite the amount of supplementation you do, you don't have the ability to properly utilize vitamin D in the
Mhm.
body. And we end up with
Cody.
everything from chronic seasonal affective disorder, potentially uh, bone issues, and immune issues. And so, it's one where I'm still learning about that. I I've only seen, I want to say, one case of that. where it was confirmed, like where they did genetic testing, blah blah blah, as opposed to just suspected. In which case, I think everybody has vitamin D deficiency, just about. So what I found was, and I'm going to use Chinese medicine because I don't have a clue from a Western herbalism or a functional medicine standpoint outside of doing good vitamin D3 supplementation. Um, I found that there was both a spleen and kidney deficiency and a lot of phlegm. And so it's funny. One of the things that's really
I can have a question off of that.
fascinating about um, Chinese medicine, Ayurvedic medicine, and I would say when we look at the energetic medicine of Western herbal medicine and the Nani tips, I frequently neglect to mention them, or any traditional form of medicine. Yeah,
South
any of those
American,
traditional cultural
Irani or
medicines
Chua or any of that.
is they don't know anything about genetics. What would we do 1,000 years ago before we understood the idea of genetics, before we had blood values and all this other stuff? And so we treated the uniqueness of the individual and the pattern based on hot, cold, wet, dry, deficient, excess, tense, and lax kind of conditions. And what we find is if we understand the nature of the organism in front of us, and I say organism because it works on dogs, cats, birds, and snakes, and God knows what else we've treated. Goats, lots of goat treatments
Goats,
lately.
llamas,
Um, and,
zebras,
and
giraffes,
so if we
fish.
understand the nature of their disorder, how it uniquely manifests for them, and we understand the herbs and now modern times, the supplements and so forth, and I would argue even our medications, if we understand those energetics and match them up correctly, we're going to see an improvement. Will we change genetics? It's open to debate, but we can certainly modify it. Because when we look at vitamin D, a hormone in the body that magically comes, like we're plant-like. We don't have chlorophyll. We literally have specialized cells and genetic traits that allow us to take the energy from the sun, the light, and convert that into a hormone in our body that does all this magical stuff, like literally give us the strength of our bones, our immune system, our emotional health, all of this other stuff. And so some people show up with immune issues, some people show up with bone density issues, some people show up with emotional health issues. So how it manifests will determine how we approach this unique manifestation, whether we understand the genetics of the VDR or not.
Okay, so this is what I want to give you. I want to give you chances. I have like 42 of these questions that I could easily
No,
answer
bring them on. I
that
got
have
them.
to do with medicine making or weirdness in the realm of that, as well as some Western like survival things as well. And it might allow you to do that if you want
Okay.
to. Would you like me to
All right.
answer a few of them?
Sure, go for it.
Okay, so one of the questions that, hey there, one of the questions that we were getting is it appropriate to decoct leaves and flowers? So when we learn medicine making, especially from a folk standpoint, I try to give you these terms that you get to use that you can remember how to make medicine properly. And the proper answer that you would get is that if you had a hard part, you need a hard process to get it out. So the example would be a root, a seed, a resin, um, a bark, the kind of things that are going to really need you to break through the cellulose, or if we're trying to get a resin out of a leafy part or a flowery part. So technically the answer would be the process of decoction, especially the way that I teach it to you, is not appropriate for a soft part or what we would call an aerial part because we would lose the aromatics that went with it. Now, what we do to counter that and why we would change our mind on that are two different things. So I'll give you a way to contradict what I'm saying, like a reason to contradict that. If I was trying to get the medicine out of calendula, calendula is a really strong tissue knitter. It heals tissue and pulls it back together. It's also really effective in gut dysbiosis. And so the part that's effective from the beautiful flower that's calendula is the resin that's inside of it. So you could see where it'd be appropriate to use a really high proof alcohol or a decoction process to get the hard part of resin out of the soft item of flour. So that would be a reason right there. The secondary side of that is in the process that I teach you for making decoctions, where you have to go through 3 different sets of water and 3 different temperatures in this process of boiling it down and covered and not and yada yada. we would account for the loss of those aromatics in the very first process where we don't bring it above 140. It's in water that's cool enough for us to stick our hands in. So if it stays covered, we're not losing our aromatic parts. If you took those leaves and flowers and put them in a secondary decoction, poured that water off, saved to the side, covered it, and put those in a secondary decoction and boiled them down, you would be getting all the music, country and Western. You'd be getting both the aerial parts as well as the hard parts of the resins. Thirdly, in Chinese medicine in particular, we would instruct a person who didn't know anything. We would give them their bags for their days to decoct, and we would put to the side their leafy aromatic parts. So even if we needed to hard decoct some of those parts, we would have them divided into two things. We would have the ones that went in when the decoction process was done, and we'd have the ones that were in the decoction bag. So we'd be getting the resins out of the leafy and the flowery parts that were decocted, plus we'd be getting the aromatic medicine because we put it in at the very end after the temperature had been brought down, and we can let it sit with the lid on. So I hope that wasn't too convoluted, but
And I would
that's
say
the explanation for it.
probably one of the really important parts of all of that is the aromatics.
Mhm.
If there's volatile oils, if there's aromatics in that plant, you don't want to boil to death. But in a case like Jin Yin Hua, the honeysuckle in Chinese medicine, we're not as concerned about that. Some of the other things, there's definitely aromatics are going to be destroyed if we
Mint,
overdo it.
just
Yeah,
mint.
don't
Mhm,
boil
yeah.
your mint to death. So
Unless you were trying to get the resins out, then you divide it
yeah,
in half
but
to
like
get
the
both the
calendula,
medicines.
like you said,
100%. And so it's Britt in particular, because you're the one that asked that question. I make the joke for you guys in class that I'm going to tell you the right way to do it, and then spend the rest of the years with me contradicting everything that I said, because it's always a yes. It's not ever this is just that. I can always find a way for you to get all of the medicines, so it's appropriate for that. One of the other questions that was really, really easy to answer, and we're going to blame this on Bob. Our students, both the Chinese and the Western students, are taught by the great Dr. Bob Lindy to brush their teeth with oak sticks. So we take them out into the field and do like survival skills and wildcrafting. And Bob will tell a story about the astringent properties of oak. And he'll chew up a stick and he'll brush his teeth with them. And this past camping trip that we did with them, where we had a field study out, we had a student actually forget their toothbrush and just amazingly run around with the stick going, "This is amazing, this is amazing." And one of the questions was, is it any oak? So I'm here to tell you from a Celtic standpoint, from a spiritual standpoint, from my people have lived in Florida for 400 years standpoint, that yes, it's any oak. Anytime you're with an oak, it has antiseptic properties, it has astringent properties, and it is of value to you to heal your body. So any oak possible. Hey, Laura.
yeah, we're talking about you, Laura. And
Laura.
I want to say, and feel free to post it in here if you can, Laura. Laura just posted this awesome video where she took our usual chew stick and kicked it up a notch and made a tooth powder out of the oak. I thought it was great.
So Laura, post the video
put
for
that
everybody
in the
if you want
chat
to.
And it really brings up the question, the idea of the herb of commerce. And I want to say that
White oak is the herb of commerce.
and so the Chinese are probably like the poster child of this. They have the preferred herb, the herb of commerce. But when we look at our textbooks, when we look at Chen or Bensky, you're going to see this list of sometimes a dozen or more, usually the same genus, but different species. But sometimes you'll even see a different genus when we're looking at that. And I think Western herbalists get very caught up in it has to be white oak, it has to be the white willow bark. The reality is white oak and turkey oak and all the other oaks, water oak, are totally fine, and some actually work better. It really comes down to frequently when we look at the eclectics, what that guy started, the guy who wrote the book, what he liked. And hate to say it, I want to say almost always a he.
It was plenty.
The women were busy doing the actual hard work whilst they were sitting around smoking cigars and writing books. But the reality is your regional one, if you get to know it, whether it's, in here, white willow is another good one. We have a swamp willow and a black willow
Well, all
here.
the myrtles, how we
Uh,
can, yeah.
yeah, and so getting to know your unique regional plant may actually create a variation that is positive, or negative, or shows one attribute of that herb that's weaker or stronger
You're
than what we talk about with the herb of
you're all
commerce.
scientists, and you should be pushing forward to remember your ancestor knowledge as well as discover new stuff. And we talk about this all of the time. Decisions about what plant was right depends on what side of the mountain you grew up on. And I always say we didn't get billions of people on the planet because we only used white oak. Like wherever you are, those are the plants that were your allies. So there has to be something astringing there. So in our case, our oaks, every oak indiscriminately is astringing, is an antiseptic, is an antimicrobial, and has ancestor knowledge and takes care of you from the core of who you are. So if you're having bleeding issues in your gums, because that was part of the question,
Mm.
that is something that's going to cinch up those little capillaries and make sure that you're fortified in a way that stands you
And
up straight and strong.
and let me take the almost functional approach to that too. Actually, the bleeding gums is a common issue. And so if, yeah, you're brushing your teeth and every time you brush your teeth, you're spitting out a mouthful of blood.
You need
Uh,
more than oak.
that there's a number, gum health, oral hygiene, and all that. So there's many reasons within that can be an issue. But a very, it's like, oh, my teeth are all right, A vitamin C deficiency is very common. So we see the role of vitamin C, or a deficiency of vitamin C can lead to a variety of things if you follow Linus Pauling's work. But in particular, capillary fragility, i.e., easy bruising or easy tearing of the skin, to include you're brushing your teeth, spitting out a mouthful of stuff. So there may be a diet that is not enough vitamin C in it.
You need the pine tea.
Things that are hurting your vitamin C content, like too much sugar, too much infection, anything within that realm. And so you may find benefit from a supplementation of vitamin C or looking for foods that are high in vitamin C. No, that doesn't mean drink more orange juice. That probably
Will
means
make it worse.
more hibiscus tea, something like that. Um, the From a Chinese perspective, we frequently ignore that symptom, and it can be a sign of stomach heat. And so, one of our classic symptoms of stomach heat is the bleeding gums. And so, looking at that digestive health, which would probably go back to a vitamin C deficiency.
Okay. So many questions, Bob. Okay.
Bring it
Are
on.
you ready?
Any other fun ones online we want to dive on,
No.
rather than just all Brit all the time?
They're all congratulating us and saying thank you for being babbling crazies.
And I'm curious if you didn't already shout out like where you're from. Like, there's a few names on here I've seen wander by. Let us know where you're from. I'm like, there's some names that I recognize like from Facebook, but I don't think I know you personally. So don't be shy. It's super exciting that we get people from all around the world literally showing up and asking some of these really unique questions.
Okay, so this is a really strange question, and I like it. It's good thinking.
Hmm.
From a Western and Chinese standpoint, does cyst exist to encapsulate something foreign or toxic? What's your opinion on that? Because I think
Sometimes.
because I think the heat component to that, where it just dries up
So,
the phlegm.
yeah, so many cool questions.
Mhm.
Britt, I don't know where your brain was going that came up with all these seemingly unrelated ideas.
She keeps a running notebook.
That's awesome. So I'm going to tell a really gross story.
Solid.
That when I was a kid, I spent 1 year in Long Island, New York, and it was middle school. It was my first year of middle school, and I left New York City. We had traveled but had not moved down to the Bahamas yet. And there's a thing now, and you know
Hey,
what?
Paul is from Ontario, Canada.
Okay, I knew
Amazing.
your name. Yeah.
Amazing. Okay, go on.
And there's a room here where you go in and like put on eyewear and you go and break all the TVs and stuff.
Yeah, it's a crash room.
Okay, yeah.
It's a break room.
So
Yeah.
I invented that 40 years ago. I used to go out, and there's a deciduous forest at the time in Long Island. We were in Flanders, right outside of Riverhead, where the
Anna's
two
from
forks go up.
Vermont. Holy
Oh,
cow, you
nice,
guys.
man! We got all kinds of interesting
Mhm.
folks on here. Yay, Linda, Florida.
Yeah. Right above that,
Philly,
Philadelphia.
yeah, I
Ooh, stay
love it.
warm, people. You guys are crazy.
Yeah, like, more power to you.
Hmm.
See, Paul's bored. He can't go outside. His fingers will fall off. Uh, so,
Yes, ma'am. Sir.
uh, so I hate to say it. I would go out after school and take my frustrations out on the dead deciduous trees with, I'm sorry, Buford Pusser, the Joe Don Baker played Walking Tall that
Yeah, I
come
don't
out.
know what you're talking
Yeah,
about.
so it was the early 70s or something. I don't remember.
I
And
wasn't
so I
born
had
yet.
this big old stick, and I'd go out and I'd literally just knock down these trees. And then I'd be so proud of myself that I would look up. And so this one tree, I took out the entire center part, and this thing came down and hit me right here. It missed my eye by probably a half an inch. And so, ow, and didn't pay any attention to it. But when it healed up, I always had this little lumpy thing right there under the skin. Just didn't pay any attention to it. And then for a few years I would play with it. I stopped playing with it. And I was like, oh, where'd that go? And I couldn't find it anymore. About 30 years later,
Weirdo.
I started to sneeze uncontrollably and sneezed out this, I'm sorry, booger. And it was so odd. It was literally covered with skin and cyst-like that I opened it up. No, I don't normally do that to my boogers, but this one was special. It had weird colorations and stuff.
Grossy.
Inside of it was a piece of wood
A splinter.
that I think was literally that had traveled from there and had taken 30, 40 years to be expressed out through my schnoz.
So
Um,
sometimes is the answer.
So, yes, sometimes it is. I also find that when we look at like a Baker cyst, a different kind of cyst, that the repetitive motion, and I'm going to say a misalignment of a tendon, a muscle, and so forth, can actually be aware. So I think of some cysts are like an internal blister, if you will. That, if you got the wrong heels and you go out running, you're going to get a blister and a fluid-filled sac on the out, externally that you can pop. That sometimes they happen internally. So I look for misalignment or repetitive motion.
Okay, so let me push you on that. How does that work in Chinese medicine? That like you have taught me, and as something that I believe in.
Well, let me come back to the Chinese because there's one other weird type of.
Okay, go ahead.
So, and then we've got things like
Okay,
fibroids
by
and
the way,
other kinds.
we're on a delay. Liz is like, nice.
So, when we start to look at ovarian cysts, and in a way, that is something else. Like if there's and we think about it in Chinese, almost like a waxing or phlegm coating over the ovary, and as that oocyte starts to develop and is supposed to pop out an egg, if it doesn't, it's retained in there, and we form a cyst around it, and after a while, there's too many, and they can burst. And so when we look at PCOS and things like that,
Everyone's commenting now. Bless your hearts, you guys.
I actually told that to a patient the other day.
Think about, I talk to him every day. Think about the stories that come out.
So, and I'll talk about one more cyst, and because I think I even said this last
Because
time.
we definitely want the Chinese perspective.
Oh, I'm going to get there.
Okay.
Chinese perspective is boring and simple. So when I was in the third grade, my mother taught me to repeat this phrase so I impressed somebody in my very first science class in school. Ontogeny recapitulates phylogeny. Yes, it's sad that I still remember it even since the third grade. And this is now no longer an accepted theory, but ontogeny is the development of the egg, the fetus, recapitulates, repeats phylogeny, the phylum. So at some point we have a tail, we have gills and things like that. And so what happens is, for many of you on here, you're going to say, "Ooh, I used to, or still do, get these weird cysts in your earlobe that are gross," and you go to a dermatologist and they have to pull it out. They try to get the inner sac to get that cyst out of it. And it's not cancer or anything. It's a very common issue that people get these in their ears. And what it is if you go back to that concept of ontogeny recapitulates phylogeny, there's aspects of that are true. And at one point, we are fish-like, that we have gills that migrate down and become our lungs. And there's residual tissue that is left over in the earlobes because it's up here near our head. And those are inappropriate cells that were left in the earlobe, and it becomes those cysts later on in life. And so we usually see those in teens and 20s, and then the body actually gets done trying to expel them or has successfully dispelled them. In Chinese medicine, it's so simple. It's a lumpy thing. It's phlegm. Sometimes it's got blood
Okay, so
stagnation with it.
let's do. I was going to say let's do a
It's
little.
so boring.
Let's do a little better than that. Why does one phlegm come out your butt, pee, or nose? Why does another phlegm get hard and encapsulated?
So there is. So if I eat bad food, if I go and eat cheese and drink wine and have lots of carbohydrates, I will be a snot fest. I will produce my spleen chi, my digestive energy, my agony in Ayurvedic medicine is weak. Thanks, military. And so if I eat things that are inappropriate, that challenge my digestion, it does not do a good job of digestion, and it creates phlegm. It is addressing that irritant, and it shows up in my nose. In Chinese medicine, we look at the poor spleen qi with the T&T function, the transformation transportation, does a poor job of separating the clear from the turbid fluids. And we say the spleen, the digestion, is the producer of phlegm, and the lung is the container. And an external opening for the lung is my schnoz. So it shows up as snot. I have chronic rhinitis, sinusitis, whatever you want to call it. So what happens is if I add, that can happen in other parts of my body. And if I add to this drippy faucet, dampness, excess moisture, so forth, and I add to that another factor, and that other factor can be heat. And you've all experienced this. If you left some cream of mushroom soup in a pot, and you left it on a low heat, you were going to have it in just a few minutes as soon as it got hot, and then you got distracted and it congealed, then you had to take a hammer and chisel, or you probably threw out the pot after that. And so that is heat causing this hard mass. We can add to that cold. Like what happens when we have gelatin and we add hot water and flavoring and we are going to make Jell-O, we throw it in the refrigerator and it congeals into this gelatinous mass. And so cold can cause a hardening in the same way that heat can. But we can also add other things like stress, stagnation. That heat can come from stress, inflammation, lots of different ways to think about
I realize
that.
I don't know what I'm saying with this, so you can correct me or manipulate it all that you want. Blood heat, blood stagnation?
Blood is a type of heat. Blood heat is when there's heat in the blood, can lead to blood stagnation. And so we don't define things necessarily in Chinese medicine. We don't necessarily call it a cyst per se.
Yeah.
So,
and she knows that we're being broad.
And so
stuck there. That's a nodule.
Lumpy things,
that are hard
that don't belong in our body, can be watery to like literally like a blister. Too hard and we can look at neoplasm. We can look at tumors and malignancies and so forth. Can be a type of phlegm. And we can combine those with heat and cold and qi stagnation and blood stagnation. And it's the uniqueness of how it manifests, its coloration, its response to hot or cold, its response to the feeling of pain, the stress. All of those will help us determine that energetic imbalance that created this hard, lumpy things, and helps us to select the most effective herbs for that hard, lumpy thing.
So take a drink, and I'm going to have a slight discussion with you. The first thing I'm going to say is it's 7:15. You have 45 minutes.
We're rocking it.
So I'm going to let you choose according to the time you have left. You still have goose syndrome you could discuss.
No, let's save that for the next.
Hold on, because I have some really good ones. Do you want to stick strictly with the things that combine Western and Chinese, or do you think
I like that? I like cross-pollinating between the systems.
All right, so I had a really good one here, and I want you to give me an opportunity to talk about this, because when I am in the jungle, in particular, they have a lot to say to me about this, about my people at home, even though they've never seen them. And so I think it's an interesting thing to talk about. So it is, hey, because she's talking to you guys, high rate of prolapse in the U.S. What's up with that? Okay.
I forgot that question.
Yeah, and so that was a really good one. So we're talking about vaginal issues. So I think in general, we could even pull this over to the male side. Any urinary prolapse, anything falling down,
So
any uterus, urine, kidney, anything falling down.
So I'm going to start with the Western thought, the Western
And
medical
remember,
thought.
I want to say
Yeah, yeah,
something
no,
about
I
this.
know because it actually matches very well, I think, with what we see the indigenous people in South
Hmm.
America talk about. Western medicine, we see rectal prolapse, we
Hmm.
see vaginal prolapse, bladder prolapse.
Even
Uh,
varicose veins and spider veins, we can look at it as
can
falling
be a,
out.
a,
Yeah.
a
Hmm.
type of that, and we tend to see it when we had abdominal surgery, multiple births, that the pelvic floor muscles are weak, and so
But I think it's becoming more common
it,
without the
it
surgeries.
I actually, Britt, I'm with you on this. I actually do think it's more common, and remember that the rates of C-sections was astronomical, that the
Absolutely.
majority of births 30, 40 years ago were C-sections for the convenience of the freaking
Hmm.
OB. And so we are seeing that they're finding out that slicing somebody's abdomen open
Not so much.
is maybe not in the best interest of
Mhm.
the client, the patient. So we've seen a reduction in many areas of the country and in the world where they're trying to say, hey, this is a healthy woman. She can have a normal birth like they did for the last 100,000 years.
Pop that
Um,
fucker
so
out.
so the let me switch to, and I do think we are less active than we used to be. It's funny, we're having less children than we used to. It was very normal to have 10 or 15 children back in the day, and that way multiple childbirths was a potential cause for prolapse. So we're having less children, but we're seeing a higher rate of various prolapses. And I would argue from a Western standpoint, it's a weakness of the pelvic floor, looking at things like Kegel exercises, and our greater level of inactivity. Um, from the Chinese perspective, it starts to get interesting. So we look at prolapse as a very specific dysfunction, if it is prolapse of the spleen qi. We say that one of the functions of qi in general is to hold things up. If we're looking at the mesenteric membrane in the abdominal cavity, that is a chi function to maintain that stability of your organs. Um, and so the idea of spleen qi deficiency in Chinese medicine is a poor digestion, poor metabolism. It is most affected adversely by the flavor sweet. And so, what does the American diet? What does the modern society's diet consist of primarily? Yummy stuff that are sweet. So I would argue both from the lack of activity, which we also associate with the chi or the energy of the body, um, but also the poor diet is having as much of an effect on our the failure of the chi to hold our stuff in place. And I'm going to just have some fun for any of you who don't know Chinese medicine stuff. Um, that idea of spleen energy, the spleen chi, we look to its relationship to the muscles, pelvic floor muscles being weak, so the weakness of your muscles, that holding power of the chi, all of these things relate back to that. And I want to give the funness of Chinese medicine. I want to just give a really unique example because the running joke, it's like organ prolapse is stuff falling down, stuff falling out. I had a client come to me with narcolepsy, and I knew what narcolepsy was. It's the falling asleep for no reason. Literally, you could be sitting here falling asleep. And so I knew what narcolepsy was, but honestly, I don't understand a disease just because I read about it in a science book. And so I had this person, and they were in ridiculous. They were an aerobics instructor, and they ate generally better than most of us, and managed their stress well. I was like, and yet she had this weird, and narcolepsy is considered autoimmune. She had this weird autoimmune disorder that I was like, all right, I got to figure it out. And so I went to the tongue and pulse, and the only thing I could see that she had going on was she had some spleen chi deficiency. So I did what I oftentimes do when I'm confronted with a rare disorder that I'm not terribly familiar with. I haven't seen 1,000 cases of or anything. And so I was like, what does it feel like? what does your disorder feel like? And so I was like, so in that, is there an awareness in those seconds before you start to nod off?
Cody.
And she's like, it it literally, the way she described it, feels as if my eyelids are falling down. She's like, I'm not tired, I'm not sleepy. It literally, the eyelids fall down and I know I'm about to go to sleep. And so I was like, I can work with that. And so I gave her a classic Chinese formula called Buzang Yiqi, which is for prolapse. And I saw probably about a 70 or 80% reduction in episodes of her narcolepsy. Since then, I've seen a number of cases. They all had a similar tongue presentation and described the sensation of the eyelids falling down or being heavy. I ended up giving them all the same stupid formula. No, it's not stupid. It's a great formula. It's an amazing formula. And I think, is one of the most instructive formulas out there for the understanding of directionality and energetics in herbal formulas. I Bensky's description of Wuzong Yiqitong changed my understanding and beliefs about herbs and formulation. I will say that.
Okay, so somebody had a question about something I said. We don't have to answer
Oh,
that.
and wait, you didn't talk about the spiritual binding stuff, and I think that's super important.
Okay, so the other thing is, for those of you who don't know me,
Thank you, Julie.
yeah, for those of you who don't know me, I do a lot of work in South America with tribes, both in highlands and lowlands, to the point where they know me. And one of the things that happens when I go down there, they're always excited. It's months between times so I get to see them. And they always have messages for me of what the plants are saying. They'll say things to me like, the trees were waiting for you to come and they were telling me this. And one of the things they go crazy about is they will say, the trees are telling me that the women or the people from your land, now remember, these people have never even seen electricity. They have no idea what my land is. That well, I guess that's a very
Some of them have
narrowed
electricity.
version of the way, well, not the ones that we are around. So they'll say the people who the trees are saying that the people in our land are dealing with their and fill in the blank. And one of the things they say is they want me to explain why our women's hips are too big and why the babies are always falling out and why their parts are always falling out. And at first it was off-putting because I was like, how do I explain that we have too much, so we eat too much when, we're literally hunting for our food that day? And that's not what they meant. So I learned real quickly, and for any of you who are traditionally trained by me, you know this, that we would immediately wrap and bind the mother. We would wrap all the people who were present during the birth, male or female. You would have your medicine belts on. You would have wayusa around your neck. You'd have all kinds of things because our containers would be open during birth and death. And the fact that we don't wrap our people up, that we don't slather them with oil, give them protections, and close them back after they've had an opening of birth and death means that their parts just start falling out. Everything just starts falling out. And if we can do this hip binding and this oiling and this medicine that I've been taught to make, that those women's hips will turn back in, that they will close back up, all their prolapsed pieces will go right back up in their body. And the argument always with me when I go see, because I go down there with somebody who is indigenous, and I go down there with somebody who is also a botanist, and she's a wonderful, wonderful elder and mentor. So we talk about it afterwards because she tries to give me a Western perspective on it. And what we always talk about is if I was caring for somebody, if I was caring for them by rubbing them, oiling them, wrapping them, if bunches of aunties and mothers were caring for everybody in the tribe, male and female, who attended this death or birth in this way, wouldn't you feel supported, nurtured, nourished? Wouldn't your tendons be strong? Would your body be able to recover? Wouldn't we be able to internally have nourishment, therefore tonification of all the proper parts? So it's kind of insinuating that our mothers or our people going through trauma are not cared for properly, or we're not eating the foods and we're not getting the support we need to be fully strength filled as we need to. So it was a huge thought process to that. In Bob's eyelid conversation, that how do we know that that person from birth wasn't cared for, or if their Jing was deficient in some way coming in, that if we just took care of them, if we nourished them and tonified those connective tissues, would they tighten back up and come back to their original state of being? It's really, really an interesting thought process.
So there's so many that we could talk about prolapse for the rest of the day.
Yeah, and we have some questions.
Yeah,
We have
so
questions too.
there's a couple things I want to add to that. It's funny. Renee and I both have traveled and learned from a lot of the
And
indigenous
you've
healers
had
down
that
there in
same
South America.
experience.
Well,
Mhm.
but and I'm going to say, if you're bored and want to see how I don't speak Spanish, but you can see me subtitled if you do speak Spanish. I've got a 12-part TV series in South America on Inti TV, INTI.
Uh-huh.
And I think they're actually, because of COVID, allowing for the episodes to be seen for free.
Yes, because they're trying to help everybody.
We have some short versions of them on our YouTube channel and the Traditions Herb School YouTube channel. But it's funny, one of the things we talk about, because we talk about not just Western and Chinese herbs, but we talk about a lot of different traditional medicine practices. And for both of us, I won't say we're experts in all of them, but we know our snippets in a variety of different traditional medicines as we've studied over the years. And one of the things we tell everybody, it's like, if you see the same herb or the same practice show up independently on different continents and different groups that didn't have communication, you should pay attention to it, because there's probably some reality to that. And there's probably something that we may not know currently or that we've forgotten over the years. So, and if Renee, if you're still on here, or anybody else is, there's a specific name for it, but both in Japan and in China,
Oh yes, the mother doesn't get out of bed and she gets
no,
wrapped.
for
And
men as well as women,
yes,
the protection of here. So in our kidney area of our
even
lumbar
the
and in the
geisha,
belt,
yeah,
the binding of that,
around
in
the kidney.
particular at night, in order to protect that, we keep our kidneys protected from the cold and the wind, for health and safety. That was a classic long-term way to maintain your longevity and overall health. And I would argue that goes very closely aligned to so
I
many of those
agree.
indigenous Americas
Be-
of the hip binding.
because there's so much
Yeah.
history of that, all the way
Mhm.
up through the Inuits, through the Yucatan, all of it. And so I don't know if you want to address something. It was called to my attention by somebody, by Paul, to go back to Owen's, because he didn't see it. I think it was Paul that said Owen had a question about heavy metal redistribution within the body, like cycling out. Like they're now seeing that there's a syndrome, and I don't know if we have time to address it. They're now seeing that there's a syndrome that if you try to flush your heavy metal toxins and you don't come out, that they recycle and redistribute within the body. And there's actually a
It's funny,
thing.
I've been saying that for years.
Right. There's actually, well, we see it in things like fat stored items that, 10 years after you smoke a lot of pot, if you flush your fat or go on a diet, you test positive all of a sudden.
That's true.
So it's not like it's like far-fetched, but they've come up with a new set of disorders that are called redistribution syndromes.
Oh, I haven't seen that.
Yeah, and so redistribution syndromes are just going to be that you have a recirculation of these heavy metals in a
So-
buildup. And the question, yes, we
Yeah.
can go on the concept of that, and yes, Bob talk, but the question would be, they're now thinking that these non-metal chemicals can even pass through the blood-brain barrier and cause neurological issues. Yes, I
Yeah.
could totally see that.
Yeah.
Do you have any thoughts on what a preparation could be for days or weeks for one to undergo a heavy, hard-hitting detox, or a protocol or a prep for a blood-brain barrier, just in case, if you had to prevent this unintended damage? And it's one of the reasons why we're really cautious about detoxes and things
So,
like
yeah,
that. So do you have anything to say about that?
I have much to say about that.
Awesome. Okay. Thank you for calling that to our attention.
Yeah, it's way too easy to miss some of these. So it's funny. I'll, even though I know we come from a few different countries here and areas, I'm going to use America as the example. The idea, we eat a lot. We, as a nation, most of our first world nations are overweight or obese, but we're starving. And I know that seems like that seems like a conundrum. Like, how could we be so overweight and yet unnourished? And the reality is we are food rich but nutrient poor. That most of our research on the health and nutrition, the nutritional components of our foods is left over from the 30s, right around the time of the Dust Bowl. And we've now, because we're doing the monocrops and we're no longer doing crop rotation or smaller farms, we're not doing the biodynamic or nourishing the soil. We just use our basic enough fertilizer to make the plant grow and to produce something, but it is nutrient poor by comparison. Um, and so we're producing more food, but giving less nutrients. We are without a doubt exposed to a wide range of toxins that we have xenoestrogens, the inappropriate estrogens, are the PCBs. I won't bother to list all the crap that's in our air, our food, our soil, our clothes, blah, blah, blah. And without a doubt, we see that it's generationally accumulating. So our grandparents maybe had fairly healthy and minimal exposure, but now we're seeing higher rates of toxicity in so many of our younger kids, especially those that are growing up in the city. And so the hormone disruptions, the reduction in fertility in both men and women, it's an issue. But the idea of a detox is, I'm going to say, from my perspective, from the ideas of Chinese medicine, to drain the stuff out of somebody when they are nutrient poor, when their bellies are full, but their bodies aren't nourished, that we take the good and the bad and make them less nourished than they were before. I do believe that when a body is supported, that when our body is balanced, when we start to ingest better foods, more nutrient rich foods, when we drink water, ideally clean water, that our body is a beautiful machine, that a well toned and tuned machine, a well oiled machine, will eliminate those waste products appropriately. And so Chinese medicine is more about creating balance than purging the system. And I think that we as a culture are more deficient than we let on. And opinions vary. No, we don't have that much excess. We have lots of, stress and so forth, and those are excesses. And opinions vary, and it kind of almost depends on the clientele you work on. And I've seen poorly done detoxification of heavy metals in particular because they're not eliminating properly. They're just following protocols. Um, the the idea that if they're not eliminating through pee and poop, if they're not ingesting enough water, if their gut biome is not balanced out, that to just as what you were asking with that, Owen, that if we start to pull out of our fat cells into solution these toxic elements, that they're getting recirculated with a secondary opportunity to damage the physical organs, forget the energetic organs. And so I always say, like, yeah, I know your hair mineral analysis, your blood test, whatever, your challenge test showed a number of toxicities. Um, but is it manifesting as symptoms? And so if it's not manifesting as symptoms, I'm all about tuning the machine, making sure that we're creating this healthy and as balanced a machine so that it processes inappropriate stuff out of our body in a more natural form over time than trying to push it out with this this drug like effect. And I think it's also important that we research the mechanism. There are medical ways to detoxify anything from petroleum products to uh, mercury and so forth. Those are very real issues, lead and so forth. There's also herbal myths.
Well, I want to say something real quick that I know you about your herbal myth, but so for the person who asked this question, and I specifically didn't say it to Bob in relationship to the chelation. because one of the
Accumulation.
things that is the problem is that that is completely unapproved and unacceptable by all the people that we trust in the world that are like medical, like educational hospitals, things like Cleveland
Some
Clinic
do.
or Mayo Clinic. They don't approve of it as of now because the side effects are so severe that there's the gain of it is moderate in comparison to
Yeah.
the side effects. And so one of the things that we run into is a problem with this, what Bob is about to say, myths about certain things and detoxification. Unless you actually were physically poisoned by something like the Mad Hatter working with mercury or working with
Yeah,
lead,
there's a time and a place.
there's a time and a place. But unless you were that physically poisoned, you shouldn't actually need
So
this.
one of my concerns is there's a lot of products on the market that are herbal in particular that are either, pardon my joke, colon blow, or just based on bad science. One of the classics, and I have repeated this many years ago. I always said I don't understand it, but this is what everybody says, and I repeated it just like everybody else that cilantro chelates mercury. And when you go and do some research, get in PubMed, look for some original research.
Current,
Huh?
current
Yeah.
original.
And so the only research, and I haven't checked in the last year, but I've checked at least annually for about 8 or 10 years. I was at an American Herbalist Guild presentation at one of their conferences where there was somebody who literally did a 3 hour presentation, I think, on herbal myths, and it was fascinating. And the one that really stuck in my head, I probably should go and look up the other ones, was this idea of that. And the idea was that it was in a peer-reviewed journal. Mercola has repeated it with links to the research and so forth. The problem was the person who did the research also was the single peer reviewer of the journal that it was published in. He also holds the patent for the methodology, which was the bidigital O-ring test, which is, do you have mercury? Yes, you do. Here's some cilantro. Look, now there's no more mercury. That was the only research that was done. And yet, every product sold on the market has a little bit of cilantro in it. And so we have to be so careful. And I hate to say it, there's so many things that we repeat is what we believe to be fact, that we were taught. I was taught that at some point in the past. I've read it in way too many places. Nobody questions it. And so one of the things I like to do is I, pro or con, I don't do muscle testing. It doesn't matter. Some people do to good success, other people don't. And it doesn't matter.
So we're not ridiculing.
But there are other methods to test for things like mercury and what was the level on A day and what was the level on B day. And this is true for many things. I always ask, I need 500 years of practice by a culture, or I need double blind placebo controlled studies. You can't pick and choose and make stuff up. And so this idea of detoxification, I think, is a great sales tool.
Drink some water.
Yeah, the I think there is greater benefit to tuning this machine up, ensuring appropriate elimination, that quality foods and liquids in and quality elimination out, and making sure, and somebody, I saw a question that had come up much earlier, the idea of lymphatics. And so lymph is part of our waste disposal system. Let's ensure that our lymph, whether we're doing massage, whether water, and there are herbs that we think of in the Western construct of lymphatics. And in Chinese medicine, I would argue that's fluid metabolism.
And I do want to say one thing, that the process that we were talking about that I
Sorry,
said
Amy.
is dangerous. It's only approved for this one certain poisoning that's very specific, that you got the lead or the mercury poisoning and it's this heavy dose and they're trying to save your life. For all the other things that's talked about for, it's so damaging that it absolutely is not approved. And so we're not trying to ever ridicule, like research us, research anybody. We just want the right answers too. And so, Amy, where you said mind blown about the cilantro, again, not to ridicule anyone
No,
for their practice.
no, go research it.
Yeah, like
But
it's one of those things when we find out, then we feel like idiots that we've
and
been fed this line our whole
I'm
lives.
actually a fan of or hair analysis.
Me too.
I did it back in the 70s when it was very controversial, and now it's becoming much more acceptable. Looking at a longer term picture of both our toxic exposure as well as our nutritional status, minerals in particular. And so, very early after I'd opened my practice, I had signed up with it was Great Smoky Labs. They've now under a new name that I forget. I signed up, and so I, I I was very curious as to what my toxic status was. I am 5 years in the military. I was an infantryman. I was in Desert Storm. I don't want to say how many toxic things between fiberglass work on my sailboat to lead-based paints and copper-based paints that we would paint, and never wore protection, maybe a glove. Um, but I'm a Desert Storm vet, and so exposure to the bizarre immunizations that we got, the BP pills, the malaria pills, the burning oil wells, the chemical weapons, the depleted uranium, and it's really kind of how I came to my formal place here. That I was very sick. I went from workaholic. Those of you who know me, you know I likes to work.
Paul say an aluminum question mark.
I'm going to come back to that.
Okay.
And, and so nobody could figure out what was wrong with me. And I cleaned up my diet. Promise, I'm currently far from perfect, and I was much less not perfect back in the day. Um, uh, when I was in the military, I was a smoker and stopped many years ago. And so I probably was 40 when went and clipped a little hair and stuck it in the package. There was the practitioner, you can get a good rate sometimes in there, especially when you have a new account. And then my office manager at the time, who was a 20-something person who was probably fairly healthy, or so we thought. And when we both sent in our hair mineral analysis, when we came back, I actually was in great health. And I was definitely far from perfect, but I was in much better health than when I got out of the military. She was like so full of toxic everything. Admittedly, she was probably doing a few unhealthy behaviors
I have
that
a
were in the
question
club
about that.
scenes. But the reality was, like, she looked like death warmed over, according to her hair mineral analysis, and I was an angel. And so the question then becomes, is it because of my clean living after I got out of the military? Or was it because I was thinner than I was now, and that it's hard for us to store some of those toxins long term outside of fat, which is what some of the research that you can store them in bone and other places and tissues, but fat is one of our primary places that we see a lot of these things being stored. And so I've never been heavy until the last few years, but we have to be careful of how we utilize this unique modern information that we're getting and make sure that it matches up with all of our knowledge and that we don't chase down something that may not hold water either to the energetics or to the diversity of research. And aluminum's a great example. I don't use a deodorant, so luckily this isn't smell-o-vision. It's been a long day.
You're not stinking.
But the reality is, I do try to avoid any number of elements, both modern creations of ones as well as some that are naturally occurring in small amounts, uh, because anything out of balance is out of balance. So there's aluminum that's in seawater, and
Okay.
and so we need to not obsess and fear our food. We need to not fear our water, but to ensure that it is as clean as we're allowed. One of my running jokes to all my people, it's like, is chocolate cake good for you? No, don't eat chocolate cake every day, but the stress of your chocolate cake will kill you long
The
before the
stress of
chocolate.
not eating chocolate cake.
Yeah, right. So yes, we have I started this by saying we're surrounded by ever increasing amounts of toxicity that's passed down through our genetic line, and we're all screwed in 5 generations. We'll all be little blobs of yuck. But if we make sure our machine is as functional as possible. Our organs of elimination are amazing. And not everybody who's painted the bottom of a sailboat is going to die of cancer, but I know a lot of people who will or who have. And so make sure your machine is tuned as humanly possible and that we're putting good fuel in it. And that's your food and water.
Okay, so you're basically 13 minutes out. So I'm going to give you some.
I got to talk really fast.
No, you're not. You're going to just be really good at the thing you want to talk about. So we're going to give you some choices. There's one about intakes, which is interesting. There's one about what does a tense kidney look like an energetic. What does tenseness in a organ like tense in the kidney look like? We have
That's a fun
just
one.
like the prolapse. We have the male pattern baldness. Really, why is it this common?
So,
And so, what would you like to want me to read?
I
the
want to
tense
talk
one?
about a tense kidney.
Okay, so it said, what would a tense organ be like? Like an example, what does a tense kidney look like when we're trying to diagnose?
No, so let's so this,
Which we don't do because
and
we're herbalists.
I'm right, but I like this idea because one of the things I obviously I'm a big fan of Chinese medicine. I'm very biased in favor of Chinese medicine as this one of the most ancient diagnostic systems and herbal systems, medical systems in the world. And so I nod towards that. But Western herbal medicine, every traditional culture had something similar. And there's a lot to be said for Western medicine and functional medicine and how we look at all those things. So I kind of want to look at this idea and uniquely the kidney. I could say, liver qi stagnation. So we see these tense conditions with the energetic spiritual organs within Chinese medicine, and that's fairly easy. But in Chinese medicine, and anybody wants to correct me on this, you're welcome to, because I don't know everything yet.
Or add to, because you learn it differently.
Yeah, but in Chinese medicine, we don't see tense is considered an excess condition. So we don't see an excess in the kidneys. We actually have code where we say, damn, Pete, the lower jaw. So we put stress, tenseness in with the liver instead of the kidney, and there's a relationship, doesn't matter. But I would argue that within the system, some of the alternative medicine of Western thought, we talk about adrenal burnout. We talk about HPA axis, the hypothalamus pituitary adrenal axis. When we talk about sympathetic parasympathetic nervous system, I think those are those ideas of a tense condition. And so tense being like contracted, immovable, and usually aggravated by stress, that is our manifestation in Western thought is the kidney, the adrenals, that walnut-sized gland sitting on top of the physical kidneys is really what we're looking at when we talk about that tense in the kidney.
So please remember that you invited anyone who knew better to say something. Okay, so I'm not saying I know better. I'm going to argue with you about what
I
you
mentioned
just
Chinese
said.
medicine. Yes.
I understand, but I'm going to argue with you about what you just said because most of the time the people I see who have adrenal fatigue are collapsing. They're not tense. They're not even, their tissue state isn't even usually tense with the exception of their shoulders. They're usually falling apart. We use that term, falling apart.
I would say sometimes.
I agree because you get freaked out at first.
And I'm going to say when we look at the fight or flight, the sympathetic parasympathetic.
Fight or collapse.
Yes. So we always say fight or flight, but there's the fight, flight, fight,
flight,
and
collapse,
or freeze.
Yes, freeze.
And but part of that freeze is collapse, and so it's the fainting goat syndrome, if you will.
Exactly, 100%.
And we literally
get tense right before they do that.
Well, and that fight aspect is fight.
Yeah, but some people don't do that.
Right, and so, but that is the tense condition.
But I wanted to make
within that organ, so it's not all stress will manifest as a tense condition.
I wanted to make sure they heard you say that.
Long-term stress will frequently start as a tense condition, but long-term will deplete the body. And I would say Chinese medicine follows that suit, but we see it in association with the liver more that then affects further back. And so the tense liver in Chinese medicine then causes disruption and dysfunction in all of the organs potentially. So the reality is it will manifest in its symptoms. It will manifest in the pulse, and sometimes the tongue. But back to that kitty because it's such a
I
unique
know, but
state.
I want to real quick address Lisa and address
Oh,
Julie
sorry, I
and
didn't see
that.
it.
Lisa and Julie, that is exactly why I said that. Because I wanted to make at least the students who have learned something a little
Yes, yeah,
different than
no, what
that,
Lisa said.
just to know that like Bob's not saying everything's going to have that tense condition.
Mm-mm.
We do get people who just generally don't fight, they only flight.
So for any of you who aren't familiar with basal vagal
Yes,
response,
100%.
and so
Fainting people.
I
Yeah.
actually have I've seen a couple of cases of this, but one person it was the one who led me down this pathway
But talk
of
about the
the thought.
kidney too, because we're counting on
Yeah.
time. Yeah.
So and when we talk about adrenal, I think of that as kidney. Um, in that loose Western or functional kind of idea. But she's this high energy, high stress, trying to hold the whole world together, the family together, the work together, overworked. Gotta go, go,
Are you
go.
talking
And
about me?
no, no, actually, I could. And then periodically over the years, she's literally passed out and lost bowel control.
Oh, wow.
Um,
That's really
and
a very
and that's a
visceral
basal,
response.
yeah.
Yeah.
And so that was
100%.
long-term tense condition that then creates the fainting goat,
Mm-hmm.
that total collapse of the system.
Yeah.
And like I hate to say it, get a water balloon and try to
Mm-hmm.
squeeze it,
Eventually it's
and
gonna
it
pop.
at some point it
Mm-hmm.
pops. So you squeeze the egg. At
Gets
some point you
lax.
apply enough pressure, everything cracks, everything breaks,
Yeah.
and it falls apart. And so
So what does a tense kidney look like, Bob?
and so there's where it gets interesting.
We should draw
So
pictures for people.
it's a stress, um, and it can be irritability.
Mm-hmm.
And
Mm-hmm.
so even though we associate that with liver in
Liver.
Western,
Yeah.
or I mean in Chinese, I would say it can be prostate,
Mm-hmm. I
right?
agree.
And so an enlarged prostate, it can manifest as urinary
I was
dysfunction.
gonna say the same thing. Like that's even getting up too much to pee or losing bowel control just slightly.
I would say sexual dysfunction,
Mm-hmm.
everything from excessive sexual drive to a lack of libido or inability to orgasm.
It's just not something the body
It's
is willing to give
they
energy to.
think of your stuff is stuck. And so
Mm-hmm.
whether we're talking emotional connectedness to the reproductive organs or physical manifestation of blood fluids.
What about disconnection between emotions and like to function? You just completely deadpan because you have to function.
And it could be kind of that sociopathic,
Hmm.
autistic
I
kind
pride
of
myself in
idea.
that.
But I would also say we would associate PTSD with that. We can
Hmm.
have
100%.
that chronic fatigue fibromyalgia kind of thing that comes along with PTSD oftentimes, but we can also have the violence rage kind of things that we also see with PTSD,
Hmm.
the tenseness and excessiveness of people who've been exposed to extreme trauma, and whether it be a soldier or a car accident, that's all are forms of PTSD. They manifest. PTSD is not a single symptom, and I would argue that oftentimes can be tense and manifest as a variety of different ways, to include tense and lax at the same time,
Hmm.
depending on where we find it in the process.
So
And,
you have 5 minutes. I don't know how
and,
you want to handle 4 minutes. I
and
don't know
what
how you want to handle that.
what I want to say is, if you're just jumping online, I'm Bob. This is Renee. And it's the Bob
Hey.
and Renee Show.
Hmm.
And actually, we I saw this a while back on YouTube. There was a couple of folks doing this
Nope.
in the acupuncture
Nope.
realm
Come on.
that I was just really
Here.
impressed and thought it was wonderful that they were sharing their knowledge. They were teachers with a variety of people, and everything from beginners to students to practitioners, and doing their very best. And I thought that we lacked that in the herbal realm, but I also felt like I had something to contribute both to Western, Chinese, and traditional healing kind of ideas.
And because of us having to get onto Zoom, I had been doing this with some of my Western students, just like ask me anything
Yeah,
nights.
and we just
And
loved
we
it.
found it to be very helpful.
Helpful for the students, but we thought it was fun.
They were very encouraging and they said it was greatly helpful. So we just decided that if you guys want a chance to ask us questions, that
So
we're going to let it happen, as well as we get to hear from other practitioners, which is really important in our world.
So if you don't know it, we have both a clinical practice here in St. Petersburg, Florida, acupuncture and herbal therapies, acuherbals.com. And we also have both a Western Western and Chinese and traditional spiritual healing program here, Tradition School of Herbal Studies. I primarily teach the Chinese. Renee primarily does the spiritual as well as the Western herbal programs, to include clinical practice, where we've got 3 nights a week. We supervise our senior students in herbal care, seeing clients. And I also supervise acupuncture interns from our local acupuncture school, East West College of Natural Medicine. So check out traditionsherbschool.com. Please subscribe to our YouTube page, because we're trying to monetize that to make this a little bit more worth our time, besides just being cool and helping everybody out.
And besides that, if you go and push subscribe on the YouTube, every time we post something free, you get a notice for it. And we're constantly filming and posting. Anytime you ask us a question where we need to show you something, we'll usually film it and let everybody just have it.
And I'm super excited, because it looks like we had, again, some of the same folks, but just a really wonderful diversity of experience and traditions and parts of the world with different knowledge. And I just love that. So this is the second time we've done this. The other one is on the YouTube page for Tradition School of Herbal Studies. And so I hope in the next few days I will schedule a few more of these, probably once a month. It will always be on a Friday afternoon, or a Friday evening, excuse me, because it's literally the only day that I have free to do anything. We work 8 days a week. So please watch for it. I'll post it in both the events so that everybody can get it. Please share, please email us in advance or post on the events
Questions.
the questions, because sometimes I'm like, oh heck, I don't know, and I have to think about it for a
And I'm
minute.
trying to stop Bob and have him take a breath, because we are on about a 2-minute delay.
Yeah.
So we're going to keep the window open for anything that needs to be said, but we're basically signing off and saying bye.
I will also say that our program, because of COVID, we now do it both in person and on Zoom. So for those of you who maybe aren't in the area or don't feel secure coming into a classroom environment yet, even though we try our very best to meet all the criteria for safety, it is possible to do it live and on Zoom. So some of you more diverse, if you're interested in the Chinese or Western programs or some of our standalone classes, you can still sign up. You've got a flower essence class coming up of 3-weekend intensive with certification, lots of Thursday night spiritual classes. And the Chinese program starts every November, and we got Western, a couple of, I think next weekend is the Western 101, and we've got a couple more opportunities to start the Western program as well. So on that note, thank you all so much for showing up. Spread the word, share your knowledge. Let us know if we can answer any more of your interesting, awesome, and diverse questions. And watch for the next one that we're going to create.
Okay.
So, bye. Say goodbye, Renee. Bye, Renee. I'll post this on YouTube tomorrow evening.